The Comprehensive Rural Health Project, Jamkhed, has been working among India's rural poor and marginalized since 1970, working directly at grassroots levels through mobilization of community groups. CRHP has demonstrated that long lasting positive transformation is achievable through relatively simple yet far reaching interventions.
Well, I was raised in a rural area, and I had personal experience of having absolutely no health care either for myself or my family. And especially when I was 13 years old, there was an epidemic of plague in my village, and many of my classmates died. So I really determined that I want to be a doctor and come back and work in the villages.
The Jamkhed model is structured into three tiers: the community, mobile health team, and CRHP's hospital and training center. Village health workers are the cornerstone of all community level activities. For 4 decades, CRHP has been training women from the community to serve as local agents of positive health and social change. The woman is selected by her community and receives training in health, community development, communication skills, and personal development. The primary role of the village health worker is to freely share her knowledge with everyone in the community so as to truly put health in the people's hands. Initially, high rates of disease and premature deaths in the communities were primarily due to preventable causes. The village health workers were able to prevent and treat these ailments through door to door health education and use of simple curative measures.
I worked very hard to win the trust of the villagers as a VHW. Once there was a pregnant woman, and everyone said that she would not be able to deliver normally at home. I guaranteed her that I could do it. I checked her every month, and when it came time, I conducted her delivery safely at her home, as I said I would. Only then did the villagers admit that I really knew something from my visits to CRHP. Before starting with CRHP, I had nothing, only a mud hut with a tin roof to live in. They provided me with a loan to start a business. Slowly, I saved money to build a house. With help from CRHP, I now own a home. I have a business, and I'm respected in the community.
The results of this program have shown that over the years, infant mortality rate and malnutrition in children under 5 have sharply declined, and safe reproductive health practices have dramatically improved in the areas where village health workers operate. Undoubtedly, overall health indicators in CRHP villages are significantly better than national health indicators. The second tier of the model is the multidisciplinary mobile health team comprising of social workers, doctors, and nurses. The mobile health team visits project villages on a monthly basis to set up health camps and to follow up on patients. It serves as a link between village health workers, community leaders, and CRHP. In addition to providing primary healthcare services, the team also supports the farmers' clubs, women's self help groups, adolescent girls, and creates goodwill and support for the village health worker. This enables CRHP to be well informed about community needs and promptly address any challenges that the community faces. CRHP's hospital provides secondary care cost effective services to a catchment area of close to 500,000 people. The hospital provides emergency services, general medical and surgical care, obstetric and pediatric care, and specialist services. The aim of the hospital is to provide quality integrated health services at a low cost. Extremely poor patients may often receive free treatment. Patients' relatives play an important role in providing care during treatment, further reducing costs and ensuring post-operative continuity in care. Given the high incidence of eye pathologies such as glaucoma and cataract, the hospital provides free eye surgery. A visiting specialist performs over 150 eye surgeries every month. The village health worker, the mobile health team, and the hospital support all community based projects. This model has helped create truly sustainable projects which rely on the community for successful implementation, with CRHP supporting in capacity building and training. Village health workers serve as agents of social change in the community. With the support of CRHP's social workers, village health workers facilitate women's self-help groups and income-generating groups. By addressing various social injustices against women in today's villages, these groups empower women in various spheres of life and provide economic stability. The Adolescent Girls Program is the result of the presence and strength of the women's groups and village health workers. Through teaching adolescent girls about health and social justice, this program seeks to address the extreme gender inequity and low status of women in rural areas. CRHP, along with village health workers, organize these groups weekly, during which the girls are given the rare opportunity to learn, interact, and play freely.
I started attending the Adolescent Girls program when I was 13 years old. Before attending the program, I was very shy and lacked confidence. The program gave me the courage to stand up for myself. My parents wanted me to marry when I was 15 years old, but I told them I would not get married before I was 18. At the Adolescent Girls program, I learned that a girl under 18 should not be pressured to marry because she's not physically or mentally ready for a child. Now I'm 20 years old, and my marriage is scheduled after the festival of Diwali this year.
The Helping Hands initiative was set up with the objective of providing a means of sustainable income to marginalized girls and women who are the primary breadwinners for their families. Through teaching vocational skills, the program aims to not only support the imminent financial needs of these families, but also to empower these women to become financially independent in the long run. CRHP supports a preschool program for poor and disadvantaged children from the slums of Jamkhed. The preschool ensures that these children are given at least 2 nutritious meals a day, provides a safe space to learn while their parents are away, and encourages an early habit of going to school. At CRHP, the concept of appropriate technology is utilized on many levels, including scientific equipment in the hospital, alternative energy, and prosthetic limbs. One exemplary use of appropriate technology is the Jaipur foot. Manufactured locally by village people trained in the science by experts, the Jaipur foot is inexpensive to make and designed for rural lifestyle. Camps throughout India and other developing countries have provided over 11,000 amputees with artificial limbs at virtually no cost. Water is an issue of prime concern. In rural India, 80% of illnesses are waterborne. Therefore, safe drinking water and clean environment are extremely important. CRHP has installed over 200 tube wells with hand pumps throughout the project area. In this drought-prone area, providing a safe and reliable source of water supply is a crucial step towards improving the health and quality of life of the people. Water conservation is equally important. CRHP has overseen the construction of well over 200 check dams, reservoirs, and other structures. In order to promote sanitary practices, CRHP has also organized communities to come together and construct toilets, bathrooms, and soak pits in their villages. CRHP also runs an organic farm. It serves as a demonstration project where local farmers and international trainees learn new farming techniques. This includes organic farming, crop rotation, animal husbandry, water conservation, vermiculture, income generation from farm products, and alternatives for cash crops. The farm hosts the Mabel Arole Memorial Rehabilitation Center, which serves as a rehabilitation program for women that have been outcast. This initiative is for people affected by stigmatized diseases such as HIV and those who are victims of violence.
I was married at the age of 15. My husband started getting sick 5 months after our wedding. At the time of my first delivery, we found out my husband had AIDS. I found out later that my son and I were also infected with HIV. My husband died 2 years later, and my mother-in-law kicked me out of the house. I went to live with my parents. I could not eat from their plates or touch my siblings because my parents were afraid of spreading AIDS in the family. I could not find a job because nobody wanted to employ someone with my illness. My son died, and nobody came to the funeral. 3 days later, I tried to commit suicide. In the hospital, I met with a VHW who got me in touch with CRHP. CRHP offered me a home at the farm and took care of me and all my medical expenses. Slowly, I got better and started working and studying agriculture. It has been 10 years, and I am now the manager of the farm, and I have the respect and love of my community.
With a wealth of experiences and lessons learned over the years, CRHP founded the Jamkhed Institute for Training and Research in Community Health and Development in 1992. In recognition of the success of the Jamkhed model at achieving sustainable community-based health and development, CRHP began working with various state and foreign governments at their request. CRHP now provides a broad range of training to national and international groups, as well as individuals that range from grassroots workers to heads of organizations. CRHP is working towards self-sufficiency for most of its programs, but continues to rely on external donations to support 40% of its operational costs. Though an integral service, the hospital takes up only 20% of the total expenditure, while the rest is dedicated to community-based activities. CRHP, for its sustained commitment to empowering communities, has received several prestigious awards, including the Magsaysay Award and the Mother Teresa Memorial International Award for Social Justice.
Doctors are like chandeliers, beautiful and exquisite, but expensive and inaccessible. This lamp is inexpensive and simple, but unlike the chandeliers, it can transfer its light to another lamp. I am like this lamp, lighting the lamp of better health. Workers like me can light another, and thus encircle the whole earth. This is health for all.